Excellent. Thank you. It's always my pleasure to come to Choices and do a talk, and thank you very much for sponsoring this tonight. So those of you who have been to my talk before have probably heard this, but I'm going to say it again because I don't think we can say it too many times. So where do your hormones come from? All of your male and female hormones are made from cholesterol. So although cholesterol gets a bad rap, you have to have adequate amounts of good cholesterol in order to make your hormones, things like progesterone and estrogen and DHEA. And then we have these two little glands that sit on top of your kidneys. They're called your adrenals. And what most people do not know is that in women, when you go through menopause, your adrenals are going to be your backup hormone system. Do you really think this body is going to allow you to live to be 100 years old with no hormones? Absolutely not. So the adrenals are your backup hormone system. And when I talk about the adrenals, this is where you have to worry about being too stressed out during your 30s, your 40s, and your 50s. And then when you need that backup hormone system, it doesn't work so well. So we're going to talk about how to solve that, because the adrenals are at the root of a lot of our hormone issues. Then we have our thyroid, which sits wrapped around your windpipe, and your thyroid is like the master conductor of all of your hormones in the body. And in North America, especially in northern parts of North America like Canada, we have an epidemic of low thyroid. Part of it is because we don't get enough sunshine, we don't get enough sea vegetables like iodine. And when you have thyroid disruption, you have hormone havoc in the body. And there's a big problem because when you go to get your thyroid blood tests, unfortunately, the range of normal is too broad, and doctors often tell you that your thyroid is fine when it is not. So you have to be very aware of when you get a thyroid test, the number should be below 2. If it is above 2, meaning that your thyroid is not working well, because the higher your number, your test result is, the worse your thyroid is, the lower it becomes, which is even more confusing for people because the higher the number, the lower your thyroid. You want to have your thyroid test result, your TSH, below 2. So that's a really important number for women to remember. Never let someone tell you your test results are normal. Always ask to look at them. You don't have to be a doctor to read your test results. Your liver is very important because this is where the detoxification of hormones happens. It's also where your hormones are converted. And when I show you how the hormones pathways work, you'll understand why this is important. And this is also where hormones are conjugated or changed. Then you have your gut, which is everything from your mouth to your butt. And if you have gas, burping, bloating, constipation, or diarrhea, you have gut problems. And your gut is involved in detoxification of hormones. It is also involved in converting hormones. Now, hormones can stay good or they can go bad, and we're going to talk about that when we look at the pathway. And then your fat cells are really hormone factories. And my daughter and I were talking about this in the car on the way out here because she was asking me about perimenopause. And this is where you get the big surges of estrogen. Why? Because you're heading to the last hurrah, and the body wants you to pack on more estrogen in your fat for those days when you don't have so much. But fat cells are hormone factories. And the ovaries are relegated to the bottom of the list because although ovaries are very important when you're trying to have a baby and to have normal menstrual cycles, in every single woman they're going to shut down. So I put them at the bottom of the list because for half our life they don't work. And in a lot of women they're removed as well. But the body is brilliant because it leaves you with a backup hormone system in your adrenals. So here's the hormone chart. This comes right out of a first-year medical textbook. Cholesterol is made into pregnenolone, then it's made into progesterone. Then progesterone goes across and it is made into testosterone. And then your testosterone converts to estrogen. And there's not just one estrogen, there's several estrogens, and some are really good and some are not so good. And so when you take something like progesterone, which a lot of women take, they think, oh, progesterone's safe. It's not going to have anything to do with estrogen. But guess what? Your progesterone is converted into testosterone and into estrogen. So it's not 100% safe either. It has to be used cautiously. Then let's talk about what a normal menstrual cycle is. And this is incredibly important if you have kids. If you have daughters, do you know that 60% of moms never talk to their kids about periods or any of this? It's like a complete surprise in most families. But we need to know what a normal menstrual cycle is. Why? Because an abnormal menstrual cycle is actually your first and earliest warning sign that you have hormone dysfunction. And so when we look at how do we count and understand a menstrual cycle, so every month you're supposed to have one. It's supposed to show up every 21 days or every 28 days, but it's supposed to do it the same every month. We call that regular. And then what happens, and we count the first day of bleeding as day one. In the first half of the cycle, estrogen rises. What is estrogen's job? It's to make your uterine lining nice and thick and juicy. So if an egg gets in there during ovulation, the baby has somewhere to live for the next 9 months. So estrogen goes up at the beginning, then somewhere around day 10 to day 15, you ovulate. That means you pop out an egg. That's a really important date to note if you want to get pregnant, and an even more important date to know if you don't want to get pregnant. So probably an important thing to talk to your kids about. And then in the second half of the cycle, estrogen declines and progesterone increases. Why does progesterone increase? Because if you actually got pregnant, progesterone would rise 100-fold, and that's to keep you pregnant. Okay, that's a normal cycle. That's what should happen every month. This is effortless. You're not chained to the bed with a heating pad. You're not in pain. You don't feel crazy. You're not bloated. You feel great. Your periods last 3 days, maybe 4, and they're not flooding, and they're not clotting, and they're not all those bad things. Okay, anything other than normal is telling you your hormones are out of balance. So women who spot all month long, it's because their progesterone does not go up. And women who have heavy periods, it's because their estrogen is way too high, made the uterine lining super thick and thicker and thicker and thicker. And then when you finally do have a period, it's like the floodgates open. Then we have things like precocious puberty. We are seeing little girls get periods and breast buds and develop before the age of 8. This has a lot to do with weight gain, insulin, the diet we're consuming, and all of the estrogenic hormones that are in the environment. So hormones in the environment are something we don't think about. So you have the hormones that your body makes, and then we have hormones that we are actually eating or exposed to on our skin. Now this is really dangerous for kids. So by the time a child is 5, they've received about 90% of their lifetime toxic load of environmental hormones. And our kids today we're seeing a lot of effects due to that. So where would you find estrogenic compounds, for example? Pesticides, herbicides, fungicides, they are all estrogenic. Why do I tell people to eat organic foods? So you do not get estrogens in the pesticides. So you're not eating them all the time. Parabens, phthalates, these are found in cosmetics. The great thing is when you go into the beauty care department in the store, you will notice that they don't have parabens in those products because those are estrogenic. Dry cleaning chemicals, those fabric softeners and dryer sheets that everybody uses, they are full of hormones. You do not want to have those in your house. Cleaning chemicals especially, all the plastics, do not ever microwave in plastic. Never put plastic wrap on something and microwave with it. Farm fish, the pill and HRT are listed in the top 10 cancer-causing agents on the FDA's website. Commercially raised meat and dairy, so not the organic, wild, free range that we get here. Alcohol raises estradiol, which can be a really bad hormone if it converts into the bad estrogens. Soy products have been found. 1 8-ounce glass of soy milk will raise your estradiol by 380%. So soy is not a healing food. I will not even call it a food. It is a hormone disruptor. And of course, children are affected more than adults from all these hormones. So just to talk a little bit about this hormone through the ages, what we're seeing. So we know when babies are born that they have kind of a surge in development to define girls and boys. Then it kind of goes quiet for a while. Then we are seeing a lot of precocious puberty. So this is signs of sexual development before the age of 8 in girls and before the age of 9 in boys. This is not a good thing. Precocious puberty is associated with early onset diabetes in adults. Tweens and teens, this is when you would normally see sexual development. When does it start happening? When you're around 90 to 100 pounds. On the flip side, if you are a super thin woman trying to get pregnant, it's probably not going to happen very well because you have to have enough body fat in order to have regular menstrual cycles. Period problems, as I said, are the earliest warning signs of hormone imbalance. So we have no periods or scant periods, or we have painful periods, or we have heavy periods, and of course PMS. All of these things are telling you that the hormones are not in balance. Acne is a symptom of high levels of testosterone. In boys, one of the things that most moms don't want to know is that when your son's terrible acne goes away, it's probably because he's having regular sex. In girls, it's also associated with elevated testosterone. Why do women in their 40s, 50s, and especially around menopause start to see acne? Because when we go through menopause, we make more testosterone than estrogen, and this is what causes us to have acne and male facial hair growth. Then we have PCOS, which is actually a hormone condition associated with elevated insulin. Remember, insulin's a hormone too. And high testosterone, and then high dihydrotestosterone, which is what testosterone is converted into. Infertility, we have 1 in 6 women who are infertile. Sperm counts have dropped by 50% since the 70s. Why is this happening? Because of all the hormones in our environment and our food. And there probably is some other reason that nobody really wants to talk about. Things like uterine fibroids, endometriosis, breast cysts, ovarian cysts, these are all caused by estrogen dominance. What does that mean? Too much estrogen in relationship to your other hormones. So those are the women that have this huge increase in estrogen. How come that happens? Stress, cortisol, and insulin both raise your estrogen levels. So the more stressed out we are, the more disrupted our blood sugar is, the higher our estrogen levels will be. So this goes back to what I was talking about with the adrenals. We've got to love our adrenals. And there's just way too much stress going down. And then we have perimenopause, which is the 10 to 15 years before menopause. What does menopause mean? Menopause means 1 year with no periods. In Canada, the average age is 52, but we are seeing women go through menopause as young as 40, especially women who have not had children. And then post-menopause is everything after that 1 year. So we often use the word menopause for everything. It only means 1 year with no periods. I actually think perimenopause, the 10 to 15 years before your periods stop, are more problematic. This is where women have heavy periods and fibroids and endometriosis and ovarian cysts. And I think that time frame is much more challenging. Plus you have kids and you're stressed and you're working and we do way too much. So adrenal glands and hormone health, this is really, I think, the key, because with the stressful lifestyles that we are all living today and the food that we're eating, we really, truly are suffering when it comes to our adrenal glands. And as I said at the beginning, your adrenals are your backup hormone system. And when your ovaries shut down or start to decrease in function, your adrenals are supposed to pick up the slack. The other thing is your adrenals and your thyroid are linked. So when your adrenals become tired or what we call exhausted, your thyroid goes low. We can often bring the adrenals back quite nicely with stress reduction and nutrients and things like that, but the thyroid will stay low. And that's a big challenge for our hormone balancing. So the adrenals produce progesterone, estrogen, and testosterone. In males, the adrenals are the exclusive source of estrogen. So when men are stressed to the max, what do they get? Beer bellies and breasts and erectile dysfunction and moody old man syndrome. That's what happens to them. And exhausted adrenals promote low thyroid, and exhausted adrenals are linked to imbalanced hormones in total. So what are the symptoms of what we call adrenal fatigue? And if you went to your doctor and said, I think my adrenals are exhausted, they would just laugh at you, because they only believe in complete adrenal failure in the form of Cushing's syndrome and other adrenal diseases. But here's one of the hallmark symptoms of exhausted adrenals. You fall asleep fine, but you wake up several hours later, 2:30, 3 o'clock in the morning, wide awake and cannot fall back to sleep. You're tired all the time. You used to be able to have a couple of glasses of wine, and now you get drunk very easily. Aching muscle, weak legs, low and high blood pressure, because your adrenals are involved in controlling your blood pressure as well. Allergies, asthma, inflammatory conditions, anxiety, and especially this insomnia, but a lot of anxiety. So women who are adrenally exhausted often find they can't sleep and they have anxiety all the time. You crave stimulants like coffee and salt. Salt cravings are very common in adrenal exhaustion. And also we can see sometimes when people are really adrenally exhausted, they look like they have a suntan, even though they haven't been in the sun. And you'll often see people who are adrenally exhausted go like this all the time. They're just sighing endlessly. And digestive problems, blurred vision. So these are just some of the symptoms of adrenal fatigue. And so what happens when you have this stress effect? So the adrenals make cortisol, which is your stress hormone. Well, you need cortisol. If a dog came racing up to you and was going to bite you, you would need this cortisol to run away. And we call it the fight or flight response. So your cortisol goes up. In the short term, it's a good thing. But what we're seeing today is people are chronically stressed. So their cortisol is high all the time. And when your cortisol is high all the time, what happens? Your liver produces more cholesterol. Also, cortisol fits into your progesterone receptors. So it fits into progesterone receptors in the body just like progesterone does. So what happens is cortisol goes into that progesterone receptor, and then your progesterone can't fit in the receptor, and then you have this anxiety, and progesterone's kind of like your warm and fuzzy hormone. It makes you feel calm, makes you feel relaxed and sleepy. And when you only have cortisol in those receptors, you have all the symptoms of progesterone deficiency, but the doctor may test your progesterone and say it's fine. But it isn't fine because your cortisol is fitting in your progesterone receptor. The big issue is when cortisol, your stress hormone, goes up, DHEA, your mother hormone, drops. Why is that a big deal? And I'm going to go back so I can show you this. So up here you see DHEA at the end. It's your mother hormone. And so when cortisol goes up and DHEA drops, none of this really works very well. So your hormones get completely disrupted. And so I'm going to talk about how we can fix that very easily using nutrients. Also, cortisol inhibits how your thyroid works. So your thyroid doesn't work well as well. And so why do some women gain weight when they're on HRT? I often get this question. So women go on hormone replacement therapy sometime around perimenopause or menopause. And what happens is because of this stress factor where the cortisol is fitting in your progesterone receptors, progesterone that you're being given either in the form of prometrium or creams, and there's a lot of prometrium being prescribed these days, it's converted into male hormones and estrogen, which results in an increase in estrogen levels. And then you get estrogen dominant. When you're estrogen dominant, you get belly fat. You also get things like fibroids and breast cancer and endometriosis and fibrocystic breasts. So how do we get that cortisol level down and your DHEA up? And for years and years and years, I recommended that people take adaptogenic herbs, things like rhodiola, ashwagandha, and suma. But they only work on cortisol. They don't bring your DHEA levels up naturally. And then when COVID hit, and I had forgotten that I'd written 2 books on the immune system until COVID hit. And when I wrote those books on the immune system, I did a lot of work around a product called Moducare. And Moducare is a very interesting nutrient for the immune system. But one of its effects is that it lowers cortisol and it brings your DHEA up naturally. Now in Canada, you can't buy DHEA over the counter. It's a prescription. In the US, you can buy it in most health food stores. And so this is a great way to bring your cortisol down and bring your DHEA up and deal with that whole cortisol stress factor thing that goes on with your hormones. And then you get the added benefits of things like allergy reduction. It also works to make your immune system work better. It's been found to treat rheumatoid arthritis. A lot of women, as they get older, start to get the signs of inflammatory disorders like sore joints and sore knees and sore hips. And so you get the benefit of that as well. This is an ingredient called beta-cytosterol glucosides. This is very different than the sterols that you would use for cholesterol lowering. This is very targeted for the immune system and to improve this cortisol DHEA ratio. And they also did research using Moducare for HPV. Now, we know HPV as the virus that causes warts, and it's linked to cervical cancer and abnormal pap smears in women. And they did this study with 123 patients in two groups, one getting cryotherapy, so that's where they freeze the warts off. These are vaginal warts or warts that are on the penis. So they're associated with the kind that ultimately can lead to abnormal pap smears or cancers. And the other group just got cryotherapy. The group that got Moducare and the cryotherapy had excellent results. They had an 80% reduction in lesions, and the results were sustained for 6 months or longer. A lot of people who have HPV warts have this happen continually. And now, of course, in BC, they've sent all of us women these home test kits. I don't know if you've seen those, to test for HPV. And because they want to be able to do pap smears now every 3 or 5 years instead of every year, which I think is a huge mistake for women. Because if you've looked at this little test kit, it's not so easy to do. And anyways, this is a great way to help deal with HPV, which is very prevalent. And I would also recommend that people use indole 3-carbinol 200 milligrams a day. If you're the woman who keeps getting abnormal pap smears, you would want to use Moducare and indole 3-carbinol to ensure that this gets under control. And then Moducare is also something you would use if you're one of those women trying to get pregnant who keeps having recurring miscarriages, because we know that there's a subset of infertile women that their immune system is actually attacking the sperm and the egg. And that is why they cannot get pregnant. Their immune system has decided the sperm is an enemy and is going to destroy it. So those women have a very hard time getting pregnant because of this. And one of the things you want to do is get that immune system back working properly. And Moducare works by controlling natural killer cells and balancing the immune system. It's one of the things you would use, especially if you're going to a fertility doctor because you're having recurring miscarriages. Then let's talk about what would you use? So what if you're one of those women who has PMS and PCOS and endometriosis and infertility and uterine fibroids? What would you use for those estrogen dominant conditions? And people who've listened to me in the past know that I love EstroSmart. I think it is the absolute gift for women, and every woman should be on it from the time she's 12 until she dies. But Vitex is also a very interesting herb. It is a progestogenic herb, so it works more on progesterone. It works directly on the pituitary gland, and it works by the producing of luteinizing hormone, which in turn increases progesterone, thereby regulating menstrual cycles. It also helps to balance two other hormones called luteinizing hormone and follicle stimulating hormone. But the great thing about Vitex is it inhibits excess production of prolactin. And prolactin in men causes breast development. too much prolactin in men causes breast development. In women who have too much prolactin, they end up with things like polycystic ovarian syndrome, infertility, obesity, acne. And low thyroid is also associated with too much prolactin. So Vitex is really a herb. It's also called chase tree berry. And this is a great herb for women to take who are still menstruating because it balances menstrual cycles out. And we use it for hormonal acne and for irregular periods and heavy periods and PMS. It also has a nice effect on depression associated with PMS. And then Vitex is also used for menopause women because remember earlier I said when women go through menopause they make more testosterone, which is why you start seeing the whiskers on your chin and sometimes you get acne or your pores on your skin get very, very big. This is due to more testosterone. And so once a woman's periods stop, the absence of follicles, that's where eggs are made, results in a reduced production of estrogen and progesterone, but an increase in testosterone. So we use Vitex to deal with this whole dysregulation that's going on. And it has a fabulous effect in menopausal women to keep those hormones in balance and to stop the conversion of testosterone to DHT. Why do women lose their hair in menopause? There's 3 reasons. One is low thyroid, which Caitlyn's going to talk about, low iron, which Caitlyn's going to talk about. One is low thyroid, and the other one is the conversion of all this testosterone into DHT. So this is why women start to lose their hair. And one of the things Vitex does is just kind of balance that all out.
Just a quick question. You mentioned EstroSense, right? That everyone should be on it. Do you take that as well as Vitex at the same time?
You could, yes. I would take EstroSmart.
EstroSmart.
Yeah.
Okay.
And they actually have a new formula they call Cycle Smart, which has the EstroSmart and the Vitex in it together.
What's that called?
Cycle Smart.
Cycle.
Yeah. Then I want to talk about sage because sage is such a wonderful old herb that has so much great research on it. It's for hot flashes, for sweating. So even if you're just one of those people who has excessive sweating, it's a great product. It's also been researched for mood. And so it has no effect on estrogen and progesterone. So it is not a herb that is hormonal per se. And so if you are on any kind of cancer treatments or you have breast cancer or anything like that, sage is one of those great herbs that you can use in that effect. Sage is also great for menopausal arthritis, for fibromyalgia. It has a great anti-inflammatory effect. Again, it has no estrogenic action. And it's also been used in men with prostate cancer who are on drugs for prostate cancer because they get terrible hot flashes. So it's been used for that as well. And it works very well in women for hot flashes or excessive sweating. And it is also one of those herbs that's great for calming the nerves. So you can grow it in your garden. You can make sage tea. You can fry it up with butter. It's really yummy like that. And put it on yams and other things. It's just the greatest, one of the greatest herbs out there. And I like things that don't have an estrogenic effect. So you will never have me recommending things like soy or red clover or maca. Those actually have a hormone effect. And if you're going to take those kinds of things, then you should be under the care of a naturopath or a medical doctor so they can keep track of your hormones, just like if you are taking bioidentical hormones. If you're taking bioidentical hormones, you should be tested regularly to make sure your hormones don't get out of balance. So everybody in this room should be on vitamin D3. Every person who lives in Canada from the time they are born until they die should be on vitamin D3. Vitamin D3, and actually vitamin D is actually not a vitamin. It has a hormone action in the body. They just are calling it vitamin-like. And so low vitamin D3 causes higher levels of testosterone. So it's very important if you're getting male facial hair growth and hair loss and big giant pores on your face that you probably need more vitamin D3. Vitamin D3 is linked to low estradiol. So if you're one of those women who wants to have balanced estrogen to progesterone to testosterone, you need vitamin D3. It also builds a strong immune system. It is related to autoimmune diseases. We know that if you have adequate levels of vitamin D3, that it reduces your risk of things like multiple sclerosis. We have more MS in northern countries like Canada because we don't get enough sunshine. You need to have full sun exposure on your skin, naked, 20 minutes a day to make enough vitamin D3. None of us are doing that. And most of us are covered up with sunscreen and hats and everything else now because they've terrified us of the sun. And yet we need to have adequate amounts of vitamin D3 every day. So my recommendation is everyone from birth till death takes vitamin D3 every day. It also helps reduce your risk of depression. It builds bone by improving calcium absorption. It enhances glutathione, which is a powerful detoxifying agent. Glutathione is also amazing for your skin. That's why we want the body to make more of it. We know that vitamin D3 reduces your risk of colon cancer. Even the oncologists will tell you this. And it is a known fact that vitamin D3 reduces your risk of breast cancer. So how much do you take? Kids need 1,000 IUs per day, and adults, in the summer, you take 2,500 IUs. Health Canada changed the dosage of vitamin D about 4 years ago to 2,500 IUs a day. Most people are not taking enough. Most people are taking 1,000, and that is not going to be enough for women, and it's not going to be enough to keep all these hormones all healthy. And in the winter, when you're, when you only have your face exposed, you need 5,000 IUs of vitamin D3. So Caitlyn has a great vitamin D3 product. I don't know if you remember the creamsicles when you were a kid, but it has this wonderful tangerine flavor, reminds me of the creamsicle. And you can spray it. So it's really easy for the whole family to take. You can spray your kids, your husband, and yourself. You don't have to swallow anything. It tastes great. And so this is a great option. Do you have it in there? No.
Not in the gift bag.
Not in the gift bag. Let's talk about vitamin C in our hormones. So first off, we cannot make vitamin C. You have to get it from your diet. Absolutely. Only 9% of Canadians are getting adequate vitamin C, according to the latest data. And, the interesting thing about vitamin C, it regulates cortisol. So you have to take vitamin C. If you're not eating a lot of oranges that are, allowed to ripen on the vine, because if they don't ripen on the vine, they don't have much vitamin C in them anyways, you should be taking a supplement with vitamin C. These are kind of like the key ones that we should be on. Vitamin C stops testosterone from converting to DHT. DHT is the bad testosterone. It's the one that's linked to polycystic ovarian syndrome. It causes hair loss in men and women. And we want to keep our testosterone from converting into the bad testosterone. Vitamin C also increases progesterone by controlling cortisol. It stops viruses from replicating. It's antibacterial. It tells all your immune cells to destroy cancer. It is needed for healthy aging. It also increases intracellular glutathione, and it controls overactive immune function. More women get autoimmune diseases than men, and so we always have to think about ways to keep our immune system healthy. And in the gift pack tonight, whoever wins the prize is going to get a bottle of vitamin C. Hopefully you tried it. Did you demo it?
Yeah, they're at the front.
If you didn't taste everything when you came in, you have to taste it when you leave. And this is a form of magnesium ascorbate. So ascorbate is vitamin C, but vitamin C on its own can be kind of hard on the stomach. So we bind vitamin C to minerals like magnesium, because it's better absorbed, it's easier on the tummy, and this also has added organic fruits in it, so it's quite delicious. You're gonna love it. I always have a container by my desk, and when I'm hungry, I eat those. So I'm gonna let Caitlyn talk about iron, and then I'm gonna come back and answer questions with her when she's done.
Don't worry, if I miss anything, she'll pipe up, so
Yeah, I will.
it's okay. She's not going far. So what is the most common nutrient deficiency globally? It is iron, and it is also the same here in Canada. And it does not matter your socioeconomic status. It hits every level of person in the country. So what is it even needed for? So iron is needed to make energy. If we don't have enough energy, we are dropping to the ground. Iron is required to make hemoglobin and myoglobin in your muscles. Iron is also used for detoxification. Your iron levels keep your heavy metals at bay. When your iron levels drop, the heavy metals can start taking over and wreak havoc on your bodies. This is very important for kids because their bodies are very small, and the heavy metals that get to them, of course their body size, heavy metals can start taking over. It's much faster for them. So heavy metals like cadmium are very, very dangerous for our children and for adults. Iron is used to make estrogen and progesterone. This is very important. If you do not have the iron there, you are not making estrogen, progesterone. And since Lorna just told us how important those two are, we need to ensure we have adequate iron levels. Iron is also used to make GABA, and serotonin are happy hormones. If you are going to the doctor for any reason, for your happiness levels, if they do not test your blood levels for iron and making sure you don't have a nutrient deficiency, you need to find a new doctor. So 80% of pregnant women in a study done at UBC had inadequate levels of iron. On average, 30% of women are actually anemic in pregnancy, and this we're going to talk about later because of the importance for the baby. So for iron and infertility, Lorna also talked about infertility with other issues with your hormones, but iron is very important. So 50% of women in their childbearing years are iron deficient. If you have low irons, you will not be able to get pregnant, or you will have continually having miscarriages. Iron is needed again for the progesterone and estrogen, also important to get pregnant. If you have inadequate iron, you don't even ovulate. So you will not have the chance to get pregnant or even have the miscarriage. You won't even get that far. Iron deficiency causes a lack of oxygen, which actually creates poor health of the egg. So we need to ensure our iron levels are high prior to getting pregnant. Iron protects against premature birth, miscarriages, and low birth weight. Now, if you have a premature birth not due to iron for a different reason, you also have to ensure you get your babies checked for low iron, because the last trimester of pregnancy is where they get their iron stores for the first 6 months of life. Iron in your hair. Women normally notice this one. So it also happens to kids. If you have a child with wispy hair that doesn't grow in nicely, that's also a sign of iron deficiency. So for kids, it doesn't grow in thick. Adults, we lose our hair. So the hair follicles contain ferritin. So if you do not have enough iron, you will not have a lot of hair. So also when the ferritin starts to decline, your hair thins and falls out. Also, interesting fact, if you have low iron, you can have premature graying. So there are a lot of people that have gone gray in their 20s and early 30s, and they also have found out afterwards that they were actually anemic from their teenage years. So they were just constantly anemic, and their hair basically just gave up, and you had the non-pigment, and it became gray. Of course, you don't have to be anemic. You can be borderline to have hair loss drop. We do know now BC has changed the levels for normal ferritin, and it has to be over 100. Over 100. And the range on one of the next slides we'll see is anywhere from 15 to about 300. So over 100 is your normal stores. So what do we look for? Now, the symptoms for kids and adults are very similar, but because of our age and our development, it looks different from kids to adults. So let's look at the kids, because if iron deficiency is starting from birth and we do not solve the problem, our teenagers will be deficient. Then in our 20s and 30s when we're trying to get pregnant, we're going to already be deficient. And then when we go and we have heavy periods, 2 heavy periods can make you anemic. So there we go again, we're still deficient. And then we hit into perimenopause and have flooding periods, more anemia, and then we hit menopause. So kids, hyperactivity followed by exhaustion. This is not your normal tantrums either. They are melting to the ground for no apparent reason. A difficulty paying attention in school and performing well in school. If these are your children or you know of these children and they've gone to the doctor because they've been flagged by the school, they need their blood work done to know if it's a nutrient deficiency or if the nutrient deficiency is actually making these symptoms worse. Dark circles under the eyes. This is for adults and kids. Now this part of your eye is very thin and rich oxygenated blood is red. So when you pull it down, it should be bright pink in there. If you have the dark circles and the pale in there, it's a sign of iron deficiency. We got cracked lips, pale fingernails, poor grades, difficulty learning, hard time falling asleep. So my second daughter was diagnosed with iron deficiency at the age of 2, and it was because she had never slept. So we were at a wellness visit, and I was at my wit's end, and I was like, I can't. We are pregnant with our third. I need to sleep. And so the first thing they said was, let's look at the diet. Let's see where she's eating. She was eating great quality food. None of it contained iron. And the things that she did that did have iron, she refused to eat them. So it is not about a poor diet. It is about the items that we are eating. And if we don't like them, we have to supplement. So anxiety, excessive fears, that's a big one, also with adults. If you're going to the doctor because of your anxiety, make sure your blood work gets done. Pica. Now we were talking about the heavy metals in the previous slide. Pica is where you're eating non-food items. So some kids will eat dirt, paper, pregnant women will chew ice. These are all signs of iron deficiency and low iron. Of course, when our iron levels drop, the heavy metals take over. So with our kids, this is very important. Slow crawling, really hard to take up new tasks, and late speech development. For adults, these ones might sound a lot more similar for you. Hair loss, dark under eye circles, fatigue. When you stand up from your office chair, you're lightheaded. Let's say you're driving home from the office or from somewhere and your favorite song comes on and you cannot make it through the song because you are winded, yet you're sitting in a car. That is a sign of iron deficiency. Rapid heartbeats, palpitations, cold hands and feet, and restless legs. We always think that restless legs has to be magnesium. Iron also plays a role. So what are the causes of these things? Diet is huge. If you are a vegetarian or a vegan, you have to pay a lot more attention to making sure you get the iron you need. It is much easier to get iron from heme, from animal-based products. Our body likes it better. It will absorb it. If you are eating the iron foods from plants, there's phytic acid and other things that are actually hindering the absorption in your body. Blood loss, as we said before, 2 heavy periods makes you anemic. If you are not filling up that cup with iron-rich foods or supplements, you are just going to get lower and lower and lower. Ulcers, injury, certain drugs also, and we have increased needs. So pregnancy, childhood, being an elderly person, breastfeeding, and athletes. So for pregnancy, our needs dramatically increase. Of course, there's a baby in there. Maybe twins, you never know. Or if you had children back to back to back, your body needs to recover before you have the next child. Childhood, we are growing from in the womb until 18 years of age. We do not stop. Our brain is growing and developing. Right after birth, if you do not have adequate iron stores, you do not even grow your myelin sheath in your brain properly. So it starts right away. We need to have the great stores for our kids. Regular exercise. The more you sweat, the more iron you lose. Poor absorption. This one is big for all ages. This is digestive issues, Crohn's, colitis, celiac. Our iron is absorbed in our small intestine. So if you have absorption issues, you are not going to be getting the iron from the food you are eating. Inflammation, infections, and autoimmune diseases as well. So hepcidin actually helps regulate. So if you need more iron, hepcidin opens and brings it in. And then if you have high hepcidin though, it will stop the iron from coming in. So some people have a problem with their hepcidin levels, and so that would get tested if you had chronic low iron. So here's what we should look like. Normal, tons of red blood cells everywhere. All those hemoglobins and red blood cells right there, they carry oxygen. So we need that rich oxygenation. Now, if we don't, and our anemic blood on the other side, anything that has to do with oxygen is lowered. So that's why we get the lightheaded. So we really need to make sure we have our great, full, normal blood cells there. And did you know? We need approximately 20 milligrams of iron per day for optimal levels. We need to be eating this every single day. The average diet only provides 8 milligrams. So unless you are paying attention dramatically to what you are eating, you will need to supplement to top that up. So we all need iron. The reason why at 6 months of age we start giving our babies the baby cereal, which now is a no-no, I believe. I think it's a new thing we're not doing. But the reason for it was iron. So we knew that at 6 months of age, our baby's iron stores were dropping. We were starting to introduce iron-rich foods. Our milk supply had less iron in it. So we started giving baby cereals, fortified with iron. Once people stopped doing baby cereals, if they did not actually add an iron into there, then those kids were not getting their iron needs met. So what do these terms all mean? Because we don't have to be anemic. So we have iron depletion, which is your body is using the stored ferritin. Then we have iron deficiency, where your hemoglobin, what your body's normally using every single day, that starts to decline and gets out of the normal range. Then when we have iron deficiency anemia, so your hemoglobin is dropping, so you have your ferritin, which is exhausted, the hemoglobin starts declining, and then you have small and fewer red blood cells. So for women, you want to have, the range for your test is about 100, so 11 to 115, or you'd see it as 110 or 115, depending on how they classified it for hemoglobin. And for ferritin, the range is from 11 to 307. So many doctors will say you're fine if you're between 11 and 307. But when you actually look at your test results from Life Labs, the 100 mark says normal. So if you're below the 100, you are actually abnormal. You want to be in that 100 range or higher. Yes, over 300 is when you have iron overload, which would take a very long time to get to. You would have to be taking high doses of iron for a very long amount of time. So testing. Parents are always afraid to have their kids tested. It is the #1 thing we hear about, and we should not be. There is far worse things than a small prick of a needle, like long-term iron deficiency. We need to solve these problems quick. We do not want lasting effects that follow them into adulthood, and then the cycle will start all over again with their kids. So when you're looking at your Life Labs results up here, you'll have under 15 is the diagnostic range for iron deficiency. Under 15, but 100 is normal. So between that 100 and 15, your symptoms just increase, and increase until you feel horrible. 15 to 30, probable. Over 30, iron deficiency is unlikely, but probably. And then over 100 is where you want to be. With kids, they don't even give this many ranges. They say under 12, you're iron deficient, and 12 to 20, you're possible. And then they just leave it at that. But the pediatricians know that anywhere under 50 ferritin for kids, the behavioral problems start. So their range for pediatricians is get it over 50 for our kids. So this one down here is actually my daughter's first iron blood draw at 2 years old, and her ferritin is 14. So when we found that out, we then went on our high dose of iron for 3 months. We got it doubled. We continued. We doubled it again. And now she's on a maintenance iron dose. This is actually why I started the line in the first place. So I spent about 10 years doing the supply chain for my mom's company, Smart Solutions now, and I was in charge of all the ingredients. I made sure those products had the right ingredients, the labels, the testing, from ingredient onto the shelf. So once the company was sold and Jameson closed the office in Vancouver, my daughter had iron deficiency, and I knew I needed to find a product for her and other parents in the same situation as me. We were trying products everywhere. They had alcohol, they had sugars, they tasted horrible. One told us how to clean their teeth because it was going to turn them gray. She hated everything. And after the doctor reminded me about 10 times, don't look at the label, she needs the product. And I was like, well, she won't take it either way. So we solved the problem ourselves. We created the BioFe Iron line for my daughter and for other kids. But it's very important to get the tests done. If you have signs and symptoms, go and get the test done. It is easy. We called the Children's Hospital, told them we were coming. It was great. So, low iron check. Everyone can do it right now. Pink, red, and white. You need to be red. So you can pull it down, nice and easy, look in the mirror. And what do we need every day? So our babies, 0 to 6 months, 15 milligrams of elemental iron Elemental is the actual amount of iron in the product that you are getting. You want make sure the product has the word elemental on it. Children 7 months to 13 years, 10 milligrams. Then we get into our menstruating years, we jump it up to 15 milligrams. Boys are at 10. Adult women, 18 milligrams. Pregnancy is 30 milligrams. That is based on if you have adequate iron stores before you get pregnant. If you did not have adequate stores, you need to increase that. And then lactating, it drops back down to 10 milligrams. So how is it absorbed? We talked earlier about the small intestine. Very important, we need that iron to make it the whole way there. So the iron we've used in the products is micronized and microencapsulated, iron pyrophosphate, so it is coated. So they micronize it, they make it nice and small. It increases the surface area, makes it easier to be absorbed, and then they encapsulate it so it doesn't have a bad taste, it doesn't make your teeth stain, it doesn't give you constipation or diarrhea, and it actually makes it to the small intestine to be absorbed. And there's a whole family of products because at every age and stage, iron deficiency can occur. And there's preferences. Kids are picky, adults are picky, and we need to have options for them. So no constipation, no upset stomach. We have unflavored drops, chewables in 2 different flavors, and of course the BioFe Plus liquid, which is a 15 milligrams of elemental iron plus B6 and B12. And these help prevent your iron deficiency and iron deficiency anemia. The big thing here is these are maintenance doses. You can take them every day. These are what you need to have in your diet every day to keep your iron levels maintained. So here we have the absorption. Our BioFe Iron absorption, you actually get the iron. So if you have 15 milligrams on that label, you are actually going to get almost the whole 15 milligrams. Compared to its counterparts there, you're not actually absorbing the amount of iron that's in the product. And absorption is extremely important for our iron deficiency. Of course, it is for the whole family. You know, yes, it's a line for kids. We test everything based on a kid's level so that for the heavy metals and everything is next to 0 because they are safe for little kids. We do not want kids taking adult products because the actual things that they're testing for are meant for this body size of an adult, not of a child. So yes, adults can take our products because they're even safer for adults. So we have lots of time for questions, so Lorna can come back up here and we can get started. Yes.
I noticed on your graph there, it showed that your C-reactive protein should be under 1. Okay, so when I said mine down, I was 8, although a friend of mine is over 100, he's got RA, just diagnosed. But what is that telling me? Like, where the hell is this that I can treat this?
Okay, so CRP is C-reactive protein. It's an inflammatory protein produced by your liver, and doctors should test this. So when you go and have your annual tests done, which I recommend everybody goes in January, and at the beginning of the year you have your thyroid checked, you should have a CRP done because it tells you how much inflammation is going on in the body. It also is a predictor of lifespan. So the higher your CRP level is, the shorter your lifespan. The good news is we can lower CRP. We use things like magnesium, even green coffee bean extract has been shown to lower CRP. So there are ways to do it. You want to look after your inflammatory markers. Also, Moducare will lower CRP as well. And so if you're taking Moducare for, you know, hormone balance, getting that cortisol in check and supporting your immune system every day, you're also going to have this benefit of CRP being lowered. But it's a very, very important marker. And one of the things when you get your iron checked, they should be looking at CRP as well, because when your inflammation is super high, this interferes with hepcidin, which Caitlyn was talking about earlier in regards to the way that iron is controlled in the body. So, but I want to add to this. So when I had my product line, we had an iron product, of course, and we focused only on adults. And then when Caitlyn started her company and had the problem with my granddaughter, I started really researching children. And I think that we're making a huge mistake. When kids are born, they check their heel. They do a little blood check on the heel to see if the child has PKU or some other issues going on. That is a perfect time to have your baby checked for iron. Considering that 80% of pregnant women do not have adequate iron, that means those babies are born with low iron. And I listened to a pediatrician talk about low iron in infants and the long-term lasting effects that are often not reversible. Things like this myelin sheath that Caitlyn was talking about. Your myelin sheath is what is wrapped around your nerves. And if your myelin sheath does not form properly, this is where you become susceptible to autoimmune diseases. And I wonder how many women, especially, who have autoimmune diseases actually had iron deficiency. I know with my mom, they didn't know anything about iron. They didn't even take prenatal vitamins when they were pregnant. And my mom was super thin, guaranteed she probably had low iron. And this is not a good way for a baby to start out their life. So iron deficiency in children is far more dangerous. And you know, we look at ADHD and some of the other conditions that kids have, and we deleted some of these slides because it was getting too long. But your kids don't do well in school if they don't do as well as they could do in school if they have iron deficiency, and especially in girls. They did studies in teenage girls who were iron deficient and found that their test scores were terrible compared to the kids who had adequate iron. Then when they took those girls and they got their iron levels up to normal, and as you saw, normal to a doctor is not normal to us. We think that should be higher. Those girls then tested adequately on the similar kind of tests. So it's very, very important that we are all on adequate amounts of iron. So now again, when you go to the doctor and you get an iron test, you really want to look at the numbers and make sure that your ferritin is 100. And I jumped up and down for joy when Life Labs changed the level to 100, because at 70 your hair falls out. And I had heavy periods, part of the reason why I developed EstroSmart, and my ferritin was 5, and I can tell you I was almost bald. And do you think the doctor told me why I was losing my hair? No. And then I discovered that it was due to the super low iron. So this was kind of an overview that we gave you on, you know, hormones, which nutrients are really important. If you want to learn more about hormones in general, I have an actual full hormone talk on YouTube. And I have one on hormones and weight loss on YouTube as well. So there's a lot more that we can go into, and literally, you know, hormones requires an 8-hour day because they are a little bit complicated. But let's stay, you know, if you have children or you're a grandma and you've got grandchildren or you have children in your family, let's really start to focus on our kids, because I think if we want to have super healthy adults, we've got to start with healthy kids. And, you know, every time I see my grandchildren eating pasta with white sauce, I'm like, thank God they take nutrients, you know, because otherwise it could be pretty, you know, debilitating for them long term. So, yes.
You mentioned about YouTube. Between the two of you, have you done one on children?
Yes.
Yeah.
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 A friend of mine just had a brand new baby. So
Oh, well, yes, this is the perfect time, is brand new babies. This is when you want to get them tested. And then just do the simple eye check. You know, I have a coffee group that I belong to, and there's only 2 women in this coffee group. There are 14 men. They're all working out in the gym. So we did a little eye check. 8 of them were so anemic, their under eyelids were white as could be. And I mean, so we think just women and kids, but it's everybody. And if your mother is in a nursing home, walk in there and look at all those ladies' hair. They're all losing their hair. They're on these terrible diets, and I don't think anyone ever looks at iron levels in women who are postmenopausal. So, yes.
What is the best overall test to get everything tested? Doctor or a naturopath? And who can
Well,
have it?
you know, there are some tests that your doctors won't do. So I'm always about saving money first, and most naturopaths are as well. And Allison is here. She's sitting in the back. Put up your hand. This is Dr. Patton. She has a clinic out here in the area. So, and we have her business cards, so we can give them to you. So, you know, go to your GP with your list of tests. Get your, you know, you can go to the naturopath. Most of them will tell you these ones you can have done and covered by medical, and these ones we have to do separate. For example, when you get your thyroid checked, they'll only test TSH, but there are other things. You should have T3 and T4 and antibodies and other things tested as well. So my recommendation is always save money first. Go to your GP, get as many tests done as you can. Bring them to your naturopath appointment. They'll probably want to do some additional tests as well. But a lot of the tests you can have done at the doctor's office. And when it comes to hormone testing, the reason why your doctor will not test your estrogen is because it's a useless test in blood. So don't even ask for it. Progesterone you can have tested in blood. Testosterone you can. But better ways to test your hormones would be in 24-hour urine or saliva. And those you have to pay for because the doctor won't do those tests. But now doctors are doing a lot of the nutrient tests. They're doing heavy metal testing, like when my granddaughter had the anemia, they also look at heavy metals. Because remember one thing, and I don't know if that Caitlyn made it really strong to you, but iron kicks out heavy metals. So it's actually protective. So we are exposed to all these heavy metals all the time. And when your iron levels are adequate, it keeps the other heavy metals out of the body. But as soon as you become iron deficient or anemic, the heavy metals get to flow in. So then we end up with elevated toxicity. So iron has a protective mechanism against heavy metals in the environment, like cadmium and other things. So it's very, very helpful for that. But it's a heavy metal that
Neurotoxin.
it's
too.
a neuro.
Dirt. It's in the dirt. It is. It's actually, so products, plants and things and produce that's all grown in certain types of soil naturally are high in heavy metals. So that's why a lot of products like our protein has cocoa in it, and cocoa is naturally a higher heavy metal because of just the way it's grown. So we test every batch for glyphosates and heavy metals to ensure that they're well below the limits for food in Canada.
Yeah.
With the big surface of biohacking nowadays,
Yeah.
what do you personally feel that fasting has an ultimate effect of hormones?
You know, let's put it this way. Fasting has incredible benefits. What kind of fasting and what are people doing and how long are they doing it for and what are they taking while they fast? So if you take somebody who does this properly, so if you do a 1-day fast with water, awesome. Anybody can handle that. Some of the juice fasts are just a big sugar fest, so probably not a good thing to do. Intermittent fasting is probably better but if you're going to cram all your calories into 5 hours in a day, that's probably not adequate either. So you want to, the kind of fasting that I did, fasting before I knew it was cool, because I didn't eat breakfast, then I would go to work and it would be 2 o'clock and I would be starving. I was doing intermittent fasting for years and didn't even know it.
We'd have to buy our food and push it through the door.
Yeah.
It's time to eat.
Yeah. But intermittent fasting is fantastic. Remember, when you eat, you create a mountain of metabolic waste. The body has to deal with that. So choosing the right foods first is always important. And, and do these things carefully. One of the things that women do is stop eating. Well, what does that teach your body? This is the body goes like this. Hey, she's starving me. I'm going to store everything now. I'm in famine. And so I'm going to lower my metabolism, and then when she does eat, I'm going to store everything as fat because that woman may starve me again. So that is not a good thing for women. Women have to be careful about the way that they eat calories, because otherwise the body is smart. It'll just lower your metabolism down to nothing. And metabolism is how quickly you burn calories. Mm-hmm. So then when you do start eating, this is why dieters tend to lose weight, but then they gain it all back when they eat and more. And then the body's metabolism is lowered. It doesn't burn calories as well. So I would get a really good book on fasting and then carefully do it and realize the body needs nutrition and we don't eat enough protein. This is the reason why Caitlyn has a protein powder, because we need to eat protein. Kids don't. I mean, how many kids are like, hey, give me the steak? I notice my grandchildren, they take the hard-boiled eggs and they pop the yolk out of the middle. Well,
the white part tastes good, guys.
the white part is good and the yolk is bad. Well, that's not going to work either. So, protein is important, and if you or your children are not eating enough protein, then do protein powders. It's a great way to make up the difference. And so, thank you.
You mentioned how doctors say your thyroid is fine when really it's not, but have you observed that the doctors are saying your thyroid is not okay, but really it's something else, like it's being misdiagnosed a lot too?
I have yet to find that. So the question was, I had said that a lot of doctors are looking at the test results, and because the range of normal is so broad for thyroid, they're saying that your thyroid is fine. So the thyroid test result is up to 5. So I think it's now 0.5 to 5. And they won't diagnose you with low thyroid till it's over 5. But that's too broad. You should be diagnosed when it hits 2. If it goes above 2, you're in a situation where you have subclinical low thyroid and you should be treated in some manner, whether it's drugs or not. But I have found the exact opposite, that it's very difficult for people to get thyroid medication. I mean, I tell women to beg for it because not having adequate thyroid makes you feel horrible, depressed, weight gain, hair loss. You know, you just are so fatigued all the time and you have no sex drive. It's absolutely awful. And I think that half the women are suffering with low thyroid symptoms. And long term, low thyroid that's not treated increases your risk of osteoporosis and of breast cancer. So it's really important to get that thyroid functioning properly. Also heart disease. They find that women with congestive heart failure often had 20 years of low thyroid that never got treated. So if you are that person who is coming in with a TSH test above 2, but not bad enough, meaning it's not over 5, beg for thyroid drugs. That's what I would do, even a little tiny dose. Yes?
I was just going to ask, if you went without your period for 1 year,
Yeah.
and then kind of at the 1 year mark, you synced with all the ladies in the office,
Yeah, and then it came back.
and then it came back, but
Yeah.
just that 1 month,
Yeah.
do you have to start?
Yes. You have to start again. So periods don't just stop altogether. So, you know, the body's kind of tricky. I often get women who say, oh, I didn't have a period for 10 months and then I got like 3 all back to back to back, like I got 1 every 2 weeks, or I had 1 long one for 6 weeks, or they didn't have it. But if you're 18 months without a period and then you get one, then you need to go have an ultrasound, because they need to make sure there's not some abnormal cell growth going on in there, and that's why you started bleeding. But yeah, you'll start again, but you'll find the second time around probably will be, it'll just end. Yeah. And you know, I want to say, like, menopause should be effortless. And I'll tell you this cute little story that a gynecologist told me in Japan. He said, in Japan, women don't get hot flashes and night sweats. They get frozen shoulder. He said they all get frozen shoulder. And I'm like, really? How come they're getting frozen shoulder? He said because their mom got frozen shoulder and their grandma got frozen shoulder. And so all the women get frozen shoulder when they go through menopause. So everyone gets frozen shoulder. So what if we change the narrative, you know? Because I really think that I don't want to discount that some women go through a nightmare at menopause, but I think a lot of it is stress and the adrenal axis that is not functioning properly. But what if we said, hey, menopause is going to be fabulous?
It is.
It is. I had absolutely I've never had a hot flash. I use my nutrients, and I mean, it could be fabulous. And there's no reason why you have to have these symptoms, because this health food store and your naturopath's office have something for every menopausal symptom you could possibly get. And so there's no reason for vaginal dryness. There's no reason for any of these things. We have something for everything. Yeah.
What if you have a male GP, that's usually pretty good, but you tell him you have symptoms like frozen shoulder, like
Yeah.
two or 3 times, then it goes to your knee, and then it goes to your hip, you get like bursitis or something like that.
Yeah.
So then he's saying, oh, it's fibromyalgia.
Yeah.
But you're menopausal. So what do you do to get the proper test? Is it naturopath?
Well, first off, if it's marauding, it's probably something else, like menopausal arthritis or menopausal inflammatory problems. And we would use things like magnesium and, meditation and exercises, gentle stretching kind of exercises. There's this great exercise for frozen shoulder where you lie on the floor and you get a broomstick without the broom on the end. And you lie there with the broom like this. So you're on the floor and then you raise it above your head like this. Well, when you have frozen shoulder, you're lucky if you can get it to here. But after a month of doing this twice a day, you can then go flat on the floor. But it takes time and practice. So I don't think it has anything to do with them being a man or a woman at menopause. I think menopausal symptoms, they can't just give you a pill. Okay, it's not like that because it's complicated. You just learned about adrenals. You just learned how these hormones work. You learned that food is screwing with it. Like, it's not so simple. I think we have to become our own detectives and start to really look at what is going on in our body. I had a year of horrific insomnia. I had to finally go do like a meditation retreat, and I had to do a complete biohacking on my brain, like what is going on up here. So, it takes time, and I would do that instead of being in the doctor's office. Unless you think you have cancer or something serious, then you should definitely be in your doctor's office often, Yes.
I know stress really affects hormones and a lot of other things, but sometimes there is a lot of stress in your life. I was just wondering if there's more in terms of supplements or foods that can help you fight off that stress.
Yes. So one thing is, if you have TELUS, they give you the Calm app for free. So, and if you have TELUS, go on your TELUS, My TELUS app. How much time do we have? 2 minutes, okay. Go on the My TELUS app and download the Calm app. It is the best app I've ever used. It is incredible. And listen to it. Listen to it when you're in the car, before you go to bed at night, when you get up in the morning. The sleep stories with Matthew McConaughey are worth every minute, I'm telling you. They are awesome. So, and then food. What food do you eat? You only eat green vegetables, okay? So the diet is simple. The healthy diet is protein, so that's organic, eggs, free-range beef, chicken, lamb, wild fish whenever you can get it. Dairy products should be things like organic yogurt. And then good fat. Yeah, and you can also come here and go through that, but good fats are extra virgin olive oil. Not light. Anything light is processed, so if it says light, don't buy it. Butter is better. Extra virgin olive oil, avocados, coconut oil. Those are kind of the good fats. And then lots of vegetables. We should be eating 5 cups of vegetables a day. We don't. You need to have lots of fiber, so vegetables are the way to get your fiber. And if you're trying to lose weight, I always say reduce fruit, but if you're not, then berries are your best, blueberries especially. So that is the diet we should be consuming. Then stress reduction is about breathing. Women are terrible breathers. We do this weird shallow breathing thing. And so learning how to breathe deep into your abdomen, and then say no. Like literally say no. Caitlin's probably laughing because I never say no. But I mean, try and say no. And the things you really don't want to do, don't do. Yeah, that's what you got to. And then take Moducare and vitamin C and, really take care of yourself. So this is our websites. If you guys want my new website, and this is the KidStar Nutrients website. And remember, the iron is for every age.